State of Cannabis.
This is the State of Cannabis News Digest, a roundup of this week's key developments in the cannabis industry.
This week, some states are adjusting criminal penalties. Others are debating whether voters should settle legalization questions directly. Several are pushing to expand medical access, lower patient costs, or build out legal markets that exist on paper but not yet in practice. And in the background, a federal clash over marijuana's classification and whether Washington will even allow that process to continue. In the minutes ahead, we'll take you inside each of these stories, from criminal justice reform and medical access to market expansion, voter fights, and a new battle in the federal budget process that could shape the industry nationwide. Stay with us. The details tell a much bigger story.
And now here is the deeper look at the key events in the cannabis world this week.
We start at the federal level, where a new clash over marijuana policy is unfolding through an appropriations bill, and where the question is whether Congress will block the funding needed to move cannabis off Schedule 1.
A new federal clash over marijuana policy is unfolding through an appropriations bill. Republican Senators Ted Budd of North Carolina and James Lankford of Oklahoma have filed an amendment that would bar the Justice Department from using federal funds to move marijuana off Schedule 1. The language is aimed at stopping DOJ from carrying out President Donald Trump's December executive order, which instructed Attorney General Pam Bondi to complete the rulemaking process to place cannabis in Schedule 3 as quickly as possible. Supporters of rescheduling have argued it could change the landscape for cannabis businesses and research. One report says Schedule 3 is expected to bring tax benefits for cannabis companies, reduce criminal penalties, and expand academic research. But the senators argue it sends the wrong message. Lankford's office says he's concerned youth use has increased since medical marijuana was legalized in Oklahoma, and Budd has publicly condemned rescheduling, citing a list of health risks and warning about effects on young people. This isn't happening in a vacuum. Similar language advanced in the House Appropriations Committee, but was later removed from a broader spending deal that passed the House, and now the senators are trying to reinsert the restriction in the Senate. Meanwhile, the DEA has indicated a rescheduling appeal process remains pending, suggesting the administrative path is not straightforward, even with an executive order. For the cannabis industry, the immediate question is whether Congress will cut off the funding needed to complete rescheduling, or whether the administration keeps its timeline on track.
That federal uncertainty shows up everywhere else in this episode. Because states are making decisions in real time, with the national legal framework still unsettled. Next, how states are treating low-level marijuana offenses and who faces criminal consequences.
Delaware's General Assembly returned to Dover this week, and among the first bills drawing attention is a proposal to scale back criminal penalties tied to marijuana. House Bill 252 would reclassify the public use or possession of small, personal use amounts of marijuana as a civil violation rather than a criminal misdemeanor. Right now, those offenses can carry the possibility of jail time. Under the new bill, penalties would be limited to fines up to $50 for a first offense and up to $100 for repeat violations. The bill makes a point of keeping DUI laws fully intact, so impaired driving enforcement would not change. Supporters frame the measure as a way to reduce the lasting legal consequences of low-level, nonviolent marijuana offenses, especially as Delaware continues to adjust its cannabis laws. The bill is one of several moving early in the session, alongside proposals on elections, education policy, and unemployment benefits. For residents, the message is narrow but clear. Public marijuana use would still be illegal, but the punishment may soon be less severe. Lawmakers are now reviewing the bill in committee as the 2026 session gets underway.
And in Missouri, there's also a criminal justice angle. but on a much larger scale, tied to a proposed constitutional rewrite. A lot of cannabis politics doesn't end in the legislature. It ends with voters. In Hawaii, Maine, and Missouri, three very different approaches are taking shape: a possible constitutional question, a citizen initiative that could unwind a market, and a sweeping proposed rewrite that would require approval before it can take effect.
Hawaii's long-running debate over cannabis legalization may soon move from the Capitol to the ballot box. State Representative David Tarnas plans to introduce legislation that would ask voters whether recreational marijuana should be legalized for adults through a constitutional amendment. Before voters see the question, the bill would need support from 2/3 of the legislature, a significant hurdle in a state where legalization efforts have repeatedly stalled. Even if it reaches the ballot, passage would require a majority of all ballots cast, with blank ballots counting as no votes. Supporters say a regulated cannabis market could improve product safety, reduce reliance on illegal sales, and generate tax revenue, pointing to experiences in other states. Opponents, including law enforcement officials, warn about public health risks and the potency of modern marijuana. For now, cannabis remains legal in Hawaii only for medical purposes. The coming weeks will determine whether lawmakers are willing to let voters settle a question the legislature has yet to resolve.
In Maine, the ballot dynamic is almost the reverse. Not a push to create a market, but a push that could roll large parts of one back.
Maine's cannabis politics are back in the spotlight, but this time, the dispute is as much about the petition process as it is about marijuana itself. A citizen initiative, now gathering signatures, would roll back big parts of Maine's recreational cannabis system, which voters approved in 2016. If it eventually passes, the measure would end commercial cultivation and sales of adult-use cannabis starting in 2028, and would also eliminate home growing. Adults could still possess up to 2.5 ounces, so it wouldn't return the state to full prohibition, but it would shut down the regulated retail market. The proposal also adds new oversight for medical marijuana, including a state-directed testing program and a tracking system from seedlings to sale or disposal. Those requirements have been resisted by parts of the medical industry in recent years. What's driving immediate controversy is how some signature gatherers are describing the petition. Representative David Boyer has shared video and audio that he says shows petitioners framing it as a product safety effort, not a repeal of adult-use sales. At the State House, Secretary of State Shenna Bellows told lawmakers her office can't police the truth of what petitioners say, only whether signatures are valid and whether the petition text meets legal requirements. Lawmakers summed it up bluntly. Under the First Amendment, petitioners can say things that aren't true. The campaign needs 67,682 valid signatures by February 2nd, 2026 to reach the November ballot. If it qualifies, Maine voters would decide whether to keep the state's adult use market or unwind it beginning in 2028.
And in Missouri, a proposed constitutional amendment could send voters a dramatically different kind of question. One that would repeal and replace existing marijuana provisions with a new framework for both marijuana and hemp.
Missouri could be headed for another major cannabis vote, but first, it has to get through the legislature. A Republican lawmaker, State Representative Matthew Overcast of Douglas County, has filed House Joint Resolution 106, a proposed constitutional amendment that would repeal and replace Missouri's current marijuana provisions with a new framework for both marijuana and hemp. The resolution has been introduced and received a second reading in the Missouri House, but the sources say no hearing has been scheduled yet. Supporters describe the plan as one of the least restrictive models in the country. The reporting says it would eliminate statewide purchase and possession limits for adults, expand the right to grow cannabis, and add protections tied to lawful activity, including limits on property seizure and changes affecting parole violations. It also includes workplace protections, banning discrimination for lawful off-duty cannabis use, while still allowing employers to restrict use at work and respond to impairment that affects safety or job performance. Medical marijuana would change too. The proposal would adjust medical ID cards, including multi-year options, and it would let lawmakers authorize self-certification, which could reduce reliance on doctor recommendations if the legislature chooses that route. And there's a criminal justice angle. The reporting describes required expungements for certain nonviolent marijuana and hemp offenses, with exclusions for minors and DUI, and a release program for people in custody for eligible offenses. If lawmakers approve H.J.R. 106, Missourians could vote on it in November 2026, or at a special election called by the governor. Until then, it's a sweeping proposal waiting for its first real test in committee.
Still ahead, what happens when public opinion runs ahead of lawmakers, and when enforcement and referendum fights turn into the next big battleground? Now to the states where legalization is being debated, but the path is complicated by political resistance or procedural roadblocks.
A new statewide survey suggests Indiana voters are increasingly ready for legal marijuana, even if the state house isn't there yet. The 2025 Hoosier survey from the Bowen Center at Ball State University questioned 600 residents and found that 59% support legalizing cannabis for both medical and recreational use. Another 25% support medical-only access, bringing total support for medical marijuana to 84%. Fewer than 1 in 5 oppose legalization altogether. The poll lands as lawmakers file new bills for the 2026 session. State Senator Rodney Paul Jr. has filed Senate Bill 286, which would legalize recreational cannabis for adults 21 and older and set up licensed sales. Representative Mitch Gore has filed a separate measure that would legalize limited possession and cultivation. But Indiana's politics complicate the story. Top Republican leaders have publicly opposed reform, questioning medical benefits, and warning that medical laws can lead to recreational use. Governor Mike Braun has offered a more mixed view, saying he's amenable to medical cannabis and suggesting federal rescheduling could add momentum, while Senator Jim Banks has argued against state legalization. For Hoosiers, the bottom line is that marijuana is still illegal statewide. Still, between growing public support and new bills being filed, cannabis policy is likely to remain a live issue in the 2026 session.
Ohio is also heading into a high-stakes season. But there, the friction is about the referendum process itself and the wording that could determine whether the question reaches voters.
Ohio's cannabis policy is entering another uncertain phase. This week, Attorney General Dave Yost rejected a proposed referendum that sought to overturn parts of Senate Bill 56, the law that tightens restrictions on recreational marijuana and largely shuts down the intoxicating hemp market outside licensed dispensaries. The decision does not end the referendum effort, but it does delay it. Yost says the petition summary contained errors that could mislead voters about what the law actually does. Organizers with Ohioans for Cannabis Choice disagree, but say they will revise the language and resubmit. At stake is a law that critics say rolls back voter-approved cannabis rights from 2023, including limits on hemp products and new criminal penalties tied to where marijuana is purchased. Supporters of the law argue it is needed to control an unregulated market. For now, the law remains on track to take effect, and the cannabis industry is watching closely. If advocates gather enough signatures, Ohio voters could still decide the issue in November 20, 2026.
Up next, medical programs, expanding in some places, still constrained in others, and the practical realities of turning legalization into a functioning supply chain. Medical cannabis is a common thread this week, but the debates vary. What products are allowed, who can recommend them, who runs oversight, and what patients can afford.
Georgia's 2026 legislative session has reopened a familiar debate over medical cannabis. The state currently allows only low THC oil for registered patients, a restriction doctors and advocates say may limit treatment options for people with chronic pain, PTSD, and neurological conditions. Veterans have become leading voices in the push for reform, describing how cannabis helped them reduce reliance on prescription medications. Industry data shows patient growth has slowed, and regulators note that the tightly capped licensing system has kept the market largely flat. Lawmakers are reviewing legislation that would expand allowable products and raise THC limits after a similar bill passed last year, but was not signed by the governor. With federal hemp rules changing and patient demand increasing, the coming months may determine whether Georgia's medical cannabis program evolves or remains largely unchanged.
In Nebraska, the issue isn't just access, it's also governance. Who controls the rollout, and whether doctors feel protected when they recommend cannabis.
Nebraska's medical cannabis program was approved by voters in the 2024 general election, but the rollout is still unfolding, and that delay is now sparking a new fight over who should run the system. State Senator John Kavanaugh of Omaha has introduced Legislative Bill 934, which would make the Nebraska Medical Cannabis Commission an elected body. Right now, the commission has 5 members and is tied directly or indirectly to the governor, with 3 members of the Nebraska Liquor Control Commission automatically serving on the Medical Cannabis Commission. Kavanaugh says voters deserve more direct control and argues that elected commissioners would be more accountable to the public. The bill would keep the commission operating as it is through January 4th of 2029, but it would require elections beginning in 2028 for 4-year terms on a nonpartisan ballot, using the 5 Public Service Commission districts and staggered term timing. Kavanaugh also introduced a second bill, LB 933, with Senator George Dungan to protect healthcare practitioners who recommend medical cannabis from criminal, civil, or disciplinary action solely for making that recommendation. The sources say many Nebraskans have reported difficulty finding in-state physicians willing to recommend cannabis, and the Commission is still drafting regulations that would allow legal in-state sales. LB 934 has been referred to the General Affairs Committee. The next question is whether lawmakers see elected oversight as a fix for a stalled rollout, or whether the current commission structure stays in place.
And in New Jersey, lawmakers are focusing on the cost side of medical cannabis, with a proposal that would apply savings at the register for patients on public health coverage.
In New Jersey, a new proposal is trying to make medical cannabis a bit more affordable for patients who rely on public health coverage. Senate Bill 1792, sponsored by Senators Troy Singleton and Joseph F. Vitale, would require the New Jersey Cannabis Regulatory Commission to establish a subsidy program that covers up to 20% of the purchase price of medical cannabis and medical cannabis products for registered qualifying patients enrolled in Medicaid or NJ Family Care. The way it's written, the discount would show up right at the register. It would be applied at the point of sale, and only after any other discounts are already used. So it's meant to reduce what a patient pays out of pocket on that purchase, not replace existing deals a dispensary might already offer. The bill also lays out the plumbing behind that discount. The Cannabis Regulatory Commission would need to coordinate with the Division of Medical Assistance and Health Services in the Department of Human Services to build a system that allows dispensaries and clinical registrants to quickly verify whether a patient is currently enrolled in Medicaid or NJ Family Care. Dispensaries would have to post signage about the program, but they wouldn't apply the subsidy or even run an eligibility check unless the patient or a designated or institutional caregiver asks for it. And then there's the business side. Dispensaries and clinical registrants would be reimbursed by the state for the subsidized portion of each qualifying sale, using money from the Cannabis Regulatory, Enforcement Assistance, and Marketplace Modernization Fund, or other funds made available for that purpose. The bill was introduced and referred to the Senate Health, Human Services, and Senior Citizens Committee on January 13th of 2026, and if enacted, it would take effect 90 days after enactment.
Coming up, where markets meet logistics, including Kentucky's first processor, Virginia's push toward a retail system, and Texas, where medical expansion and hemp regulation are moving at the same time. In several states, the question now is less, is cannabis legal? And more, can the system actually function? That means processors, dispensaries, regulators, and sometimes new rules that reshape the playing field.
Kentucky's medical cannabis program hit a practical milestone this week. The Commonwealth's first processing facility is now operating in Dayton, in northern Kentucky. The company, Bison Infused Kentucky, doing business as Toro Infused, held a ribbon cutting and says it's now converting Kentucky-grown cannabis into finished medical products. Processors sit in the middle of the supply chain, taking harvested and cured plant material from licensed growers, extracting cannabis oil, and manufacturing products that dispensaries can sell. Toro Infused says THC gummies could be on shelves in about 2 weeks, with other formats like vapes and concentrates planned later. That matters because Kentucky's dispensary rollout is still thin. Only 2 stores are currently selling, and one has already paused sales after running out of inventory. The Dayton location also shows how local rules shape the market. Cities have to opt in to allow cannabis businesses, and Dayton did, passing an ordinance in mid-2024. Company executives described permitting and regulatory hurdles, but they say proximity to highways, nearby cities, and the CVG airport made Dayton workable. As more dispensaries and grow sites come online, industry leaders say Kentucky will likely need more than one processor to keep supply steady.
Virginia is trying to resolve a different kind of market gap: legal possession without legal sales, with a bill that would set a timeline and a statewide structure for licensed retail.
Virginia is once again debating how to move from legal marijuana possession to a regulated retail market. A bill filed by Delegate Paul Krizek would allow licensed recreational cannabis sales statewide, raise the adult possession limit to 2.5 ounces, and set November 1st of 2026 as the earliest start date for retail operations. The proposal would put the Virginia Cannabis Control Authority in charge of licensing and enforcement across the entire supply chain, from growers and manufacturers to retailers and delivery services. Medical cannabis would continue under its current system, while existing operators could enter the adult use market by paying a conversion fee. The bill also outlines a tax structure that would fund regulation, public health programs, early childhood education, and a cannabis equity reinvestment fund aimed at communities disproportionately affected by past drug enforcement. After years of vetoes and delays, the legislation may suggest a renewed effort to resolve Virginia's unusual situation: legal possession without legal sales.
New Jersey is looking at the market from yet another angle. What interstate commerce could look like if federal conditions ever allow it.
New Jersey lawmakers are again looking at how the state's legal cannabis market might someday connect to other legal states, even while federal law still blocks cannabis from crossing state lines. Senate Bill 3151, filed by Senate President Nicholas Scutari, would authorize the governor to enter interstate agreements allowing commercial cannabis activity between New Jersey licensees and licensed businesses in other states. But the bill is written with a big caveat. Those agreements wouldn't take effect until one of several federal triggers happens. The bill lists 4 options, including a change in federal law that allows interstate transfers between authorized cannabis businesses, a federal spending restriction that blocks enforcement against interstate transfers, a U.S. Department of Justice opinion or memo allowing or tolerating the activity, or a written opinion from the New Jersey Attorney General saying implementation would not create significant legal risk for the state based on federal court decisions and administrative action. If those hurdles are cleared, the bill tries to set strict ground rules. It requires that out-of-state cannabis products coming into New Jersey meet or exceed New Jersey's standards on testing, packaging, labeling, marketing restrictions, quality assurance, and seed-to-sale tracking. It also requires a plan for recalls or embargoes if there's a public health issue, and it says agreements must provide for collection of all applicable taxes. The bill also says foreign licensees couldn't operate inside New Jersey without a New Jersey license and local authorization. Before any deal is finalized, the governor would have to submit the proposed agreement to the Joint Budget Oversight Committee for a 60-day review and comment period, and the proposal would also have to be posted online for 30 days of public comment. S. 3151 was introduced on January 13th of this year and referred to the Senate Judiciary Committee. And the bill text says it would take effect immediately, even though actual interstate commerce would still depend on federal conditions.
That theme, medical expansion on one track, regulation on another, shows up clearly in Texas, where the state's medical program is growing while hemp rules tighten.
After years of tight restrictions, Texas's medical marijuana program is entering a period of expansion. New laws are allowing more patients to qualify, more products to be prescribed, and more companies to operate across the state. By the end of last year, more than 135,000 Texans were enrolled in the Compassionate Use Program, a sharp increase tied to broader eligibility and greater awareness. Patients can now access inhalers, vaping devices, and topical products, though smokable flower remains off the table. Businesses are scaling up as well. New dispensary licenses are being issued, and existing operators are opening larger facilities and satellite pickup locations to reach more patients. Still, challenges remain. Only a small fraction of Texas doctors are registered to prescribe medical cannabis, and the state's massive hemp-derived THC market continues to offer easier access to psychoactive products. How those forces balance out may determine whether Texas's medical cannabis expansion reaches its full potential.
And on the hemp side, Texas health officials are considering new rules that could dramatically raise licensing fees for consumable hemp products, an issue now headed into a public comment window.
Texas health officials are considering new rules for consumable hemp products that would raise licensing fees sharply, up to $25,000 a year for manufacturers and $20,000 per store for retailers. Supporters say the changes would strengthen oversight and protect kids, but small businesses and some veterans argue the rules could shut down shops and limit access to hemp flower-based products. Public comments are expected through January 26th.
That's where things stand this week. States revisiting penalties, redesigning medical programs, building or undoing markets, and watching Washington for signals that could reshape everything from research to taxes to enforcement. Thanks for listening. If you're following these changes for policy, business, or personal reasons, the next few weeks and months will matter. And if you found this episode helpful, make sure to follow or subscribe on your favorite platform, whether you're listening on Apple Podcasts, Spotify, YouTube, or anywhere else. Leave a rating or comment to support the show, and share this episode with anyone interested in cannabis in the U.S.